Thank you for having me, first of all. I'm a physical therapist as well as an athletic trainer. I'm going to chat a little bit about what it all entails being a physical therapist and athletic trainer, plus how do you go about getting into this if it's something you think you're interested. A little bit about me. I went to St. Cloud State University in Minnesota, where I got my Bachelor's of Science in Athletic Training. And I went on to school to get my doctorate of physical therapy at the University of Jamestown in Fargo, North Dakota. I am focused on outpatient orthopedics. There's lots of different focuses. That's where I spend most of my time working though with bone and joint, seeing different injuries, as well as post-surgical cases. I am also certified in trigger point dry needling, which is something I found an interest in. Kind of like acupuncture style needles, but a different process than acupuncture. It's not the same exact thing, but it's another tool that I can use in my toolbox to help people get better and achieve their goals. The other thing I do is Grafton. It's a technique using instruments, which I'll show you guys a little bit later, that we can use to do soft tissue work, working out muscles and different things. That's a special training that I went to as well. I'm going to start out talking about athletic training. Athletic trainers are a healthcare professional. Their biggest thing is the emergency medicine component. So that's Miss P you guys have around here. She's on the sidelines for games. She's available to you after practices sometimes. What the big concern is being able to treat someone on the field when there's an injury that happens, being able to differentiate if it's an injury where we need to call 911, they need to go to the hospital right away, or is it something that, hey, you're going to go see her later on, or we need to go to the doctor, maybe get an MRI or imaging. The big difference is athletic trainers are not personal trainers. This isn't the person you're going to find in the gym. The athletic trainer is going to be working mainly sideline type sports, colleges, schools. Personal trainers do a different course. Usually it's a weekend course focusing on lifting, strengthening. Athletic training is a growing profession, so it's always good to be when something's growing, and that way you know there's going to be jobs available in that field. How do you become an athletic trainer? To become an athletic trainer, you have to go to a CATIE approved program. There are 11 different programs in Wisconsin. Athletic training is a bachelor's as well as a master's. There's two different options for that. The biggest thing I will say is they're slowly transitioning to more master's programs. If you wanted to work with a collegiate team or a pro team, more than likely you're going to want to get your master's, which is an additional 2 years on top of your 4-year bachelor's degree. In Wisconsin, schools like Eau Claire, La Crosse, Madison, Milwaukee, Stevens Point all have programs. There are also obviously programs nationwide. I went to Minnesota. That was just a school that interested me, and I went to get out of the state, see some other areas. There's schools all over the country that you can go to for this as well. And going on to, I'll just talk about it later, National Athletic Training Association, NATA, is a website that lists all those different programs if it's something you're interested in. Once you get your degree, you have to take the VOC, which is your national exam that certifies you have the knowledge to be an athletic trainer.
What type of length is that exam?
The exam is about a 4-hour exam. You don't have to take the full 4 hours. It's a 5-part computerized exam. You go in a room, much like some of you guys have probably already taken your ACTs and stuff like that, or are going to be taking your ACTs. Very similar type setting, and it's all multiple choice test. It tests everything from your knowledge on cardiac events, heat stroke, injury prevention, all those things that you learn throughout your career. There's different tools out there that help you to study for that exam. It's a little nerve-wracking. No one usually walks out feeling great, but the pass rate's pretty high.
If you fail, can you retake it right away, or do you have to?
You can. It's given 6 times a year. So within those 6 times, you can take it, I think, up to a max of 3 before you have to do some sort of remediation type course before you can take it again.
Cost?
That one is, I want to say it was around $300 when I took it. Now it might be a little bit more expensive. They're all, I know the physical therapy one is about $6. So there is a cost associated with it, so you want to feel confident that first time you're taking it, that you're not having to keep paying for the exam. The education for athletic training, your main focus is kind of these 5 domains. I already talked about that: prevention of injuries and illness, being able to examine someone, accurately diagnose, assess what symptoms they're having, the emergency care. My program required me to take a first responder and an EMT course so that you could be ready, especially in football or wrestling, some of those impact sports where there might be an injury where it could be life-threatening, that you need to be ready to take that person to the hospital. Intervention, so once you've figured out what's going on with the patient, you have to be able to, how are we going to treat them, how are we going to get them back to playing their sport, because that's usually the goal. And then as well as administration, the not so fun part of it, being able to do all the paperwork and fill out things accordingly. Again, kind of reiterating the different things that you focus on. Psychosocial is becoming a much bigger thing now. They do a lot more psychology, especially when it gets to college athletics and even professional. There's a big psychological component, and especially after someone's injured, they sometimes become very nervous about going back to that sport, going back to that situation where they've been injured. So sometimes as an athletic trainer, you have to deal with that as well. There's lots of different environments. I've touched a lot on the schools and the colleges, but athletic trainers also work in clinics and hospitals as well. They work in PT clinics, as well as Ms. P works with one of the physicians. Hospitals, sometimes they help out with the orthopedic physicians as well. The new settings you'll see, performing arts, a lot of dance companies are now hiring athletic trainers as well to help out with professional like ballet companies, as well as public safety and occupational health. There's certain businesses out there that are hiring an athletic trainer on staff to help with preventing injuries, helping keeping their employees safe and keeping them moving so that they're not having to go into the doctor all the time. I do have a little video here I want to show you. I don't know if any of you guys watch the news. However, so UW-Stevens Point has their program, and they started adding something new. Second, guys, sorry. What's your name?
I don't know.
I don't think.
You guys go log in and let's see if you.
Wait.
There's the wedding card.
Yeah, there's my dog. Is that the Wi-Fi or the, yeah?
Guest. It should just force me.
The atmosphere of VHS or VCR.
It's loading. Spinning.
Switch to Cellcom and we'll cover your cost of further termination fees or installment balances owed to your previous carrier. Cellcom, clarity in a cloudy world. New line activation, device purchase request agreement, and data subscription required. Restrictions apply. Visit cellcom.com/save. Student athletes at UWSP are taking training to another dimension.
They're the first university in the country to use a new type of technology used on Sarah McGrew. Takes a closer look.
We've heard of athletes running sprints or hitting the gym, but now UWSP hockey players are training their brains with help from virtual reality technology. A new way to train.
The initial research study that we're doing is really looking at how virtual reality training translates to on-ice performance.
Hoping to take the mental game of athletes to the next level.
I really want to get mentally tough within the game because we all have skills, that's how we got here, but the mental side of the game in college is completely different than it is in high school.
30 athletes from both the women's and men's hockey teams are testing the new technology.
Different shot patterns, different passing, quickness, getting you more mentally ready.
So, how does it work? A series of drills takes athletes through training using a virtual reality headset. And it's unique to the university.
This technology is the first Sensorina virtual reality system to be at a university in the United States.
The hope?
They're going to get better at their sport, but at the same time, we're working on their brain and their cognition and all of the mental aspects that go along with sport.
And there might be some health benefits as well.
Especially after concussions, so before we put people on the ice or put them in a more involved high-risk atmosphere, can we get them in a controlled atmosphere where we can simulate some of the drills?
And then potentially just grow it into different areas of injury prevention, rehabilitation, and return to play.
It's an exciting new challenge, keeping athletes at the top of their game.
The athletes participating were baseline tested and will be retested at the end of the season to see if any improvements have been made. In studio, Sarah McGrew, News 9, WAOW.
Thank you.
So I just wanted to show you guys, because that's an example of, it's new to them, something that's coming out, they're doing a lot of research on, and it's something that athletic trainers at that university are getting to work with and try out on their athletes. So it's something kind of new and exciting. I was actually just on this news this morning, and I saw it. That'd be interesting. So, seeing lots of pictures of my dog here. Can I touch this?
Right, touch it on work.
Probably not being interactive.
Yeah, I'm pretty
Interactive,
excited.
yeah.
From current slides, right there. There.
That's okay.
Well, okay. So, physical therapist, again, another healthcare professional. The biggest difference, physical therapists typically aren't the one you're seeing on sideline. Our patients are coming to us post-injury. We want to take a full approach looking at the patient, what deficits they have. We do a lot of examination as well as differential diagnosis to figure out, is this an orthopedic condition? Maybe it's not. Maybe there's something else going on in the body that's causing the symptoms that they're having. So that's where the doctorate as well comes in with physical therapy, because we have to have that knowledge base to know when someone needs to go see another medical professional as opposed to seeing us. Becoming a physical therapist. Physical therapy has CAPTE, which is very similar to CATIE, but that's the Commission of Accreditation for Physical Therapy Education. There are 6 different programs in the state of Wisconsin for physical therapy. There's also programs throughout the nation that you can go to. There's 2 different options when it comes to physical therapy education. There's gain your bachelor's degree, the 4 years, 3 years for your doctorate. There also are a few schools that offer a freshman entry program. How that works is you declare when you are a freshman at the university that you want to go into physical therapy. There is some sort of kind of usually probationary period where then they accept you, and then the program becomes a 3-and-3 hybrid program. So you do 3 years, you do end up with a bachelor's degree. A lot of times it's in something such as exercise science, athletic training like I did, biomedical science. There's lots of different options for that. And then you go on to your 3 years for your doctorate. It is a little bit faster paced program. The nice thing is it's 6 years as opposed to the full 7. Not all universities offer this though, so if it's something you're interested in and you might want to accelerate that, and be careful, look at what schools this may be an option with. I do believe Marquette in Wisconsin offers this program. Once you get through your schooling, you take the NPT, which is the National Physical Therapy Exam, just like the BOC. It's another, I believe this one's 5 hours you get for the exam, 5 different parts, and it is on your whole entire education. It's more involved, I would say, for sure than the athletic training, just because of the knowledge you have to have. And it is on anything and everything you can imagine. I had everything from cardiac to wound care to all different things on my exam, and no 2 exams are the same. So one might have a ton of cardiac questions, someone might have none. So it's just a variety and really tests your knowledge of everything you've learned. Next I have just the mission statement. The biggest thing with physical therapy is that we are here to help people, we're here to serve people and make sure that we are doing our best to get them back to living a full life, being able to do everything they want to do to take care of themselves and be independent. Once you complete your physical therapy degree, you pass your boards, you can go on to a residency or a fellowship. You do not have to do that. They're a year-long program. The nice thing with the residencies, you then get specialty certification, so you can pick an area of expertise. It's kind of just like when you go to college, you start to get to focus on what you're most interested in. Same thing when you go on to do a fellowship or a residency, you get to focus. So if you're more interested in sports, you can focus on that for a year. They do specific training. It is school. You're working in a clinic. You do get paid for it. Not a lot, but you do make some money, which is nice. And then at the end, you sit for another exam that gives you another initial after your name. This is a good thing when companies are looking at hiring you too. They do like these focuses. Hopefully this next video works better. We'll skip over it for now. It kind of just talked about where physical therapists work, which we can talk more in depth. Typically there's lots of different options for physical therapy, which is a nice thing. Some people are more interested in hospital setting versus outpatient like I do. The nice thing even within that, you have options between a rehab or a subacute rehab, which is very focused on getting people back to function. A lot of times you're dealing with neurological patients who have had strokes, trying to get them back to walking, back to moving. You can also work in skilled nursing facilities, which helps out with maybe your grandparents, someone you know has been in a nursing home and they're having trouble walking. This is where physical therapists come in and they help them do stuff like that. Schools as well, you can go in and work with young children. There's all sorts of different issues kids can have when it comes to starting school, especially at a young age. If it's someone with a condition like cerebral palsy or muscular dystrophy, you get to go in and work with these kids and help them so that they can get around school and move. Home health is another option, going into people's houses. Sometimes they can't leave their homes, so you have that ability to drive around. It's very flexible. You get to make your own schedule. Kind of talk just like with athletic training, industrial and workplace environments are becoming more popular because a lot of companies are wanting to have their own therapists, their own medical staff to care for these large companies such as you think of Colby and Colby and places like that. Also research is a big thing, kind of like the video with the virtual reality. They're doing their research there on that. That can be another thing that you go into, is researching different techniques, new and up and coming equipment, stuff like that. Biggest things, reasons I became a physical therapist as well, get to make a difference in people's lives. The best feeling I've ever had is I had a patient I worked with for over a year, and when she first came to me, she couldn't walk. By the time we were done, she walked out of the clinic and waved goodbye to me, and that was the best feeling because we took her from not being able to walk couldn't live in her home, had to be staying somewhere too. She was independent, could walk around, move, and was going back to work. It's just a very rewarding feeling. PT is another growing profession. There are jobs everywhere. You can work anywhere you want to. You get to also choose what kind of setting you work in. Not everyone fits into one setting, and the nice thing is you have the opportunity to, hey, maybe I didn't like working in the hospital, but now I want to work in a clinic, or I want to do home health. You can do that. There's lots of rooms and opportunity. You can also start your own clinic. You can be an entrepreneur. If that's something you're interested in, running your own business, you can do that as a physical therapist. And there's so many tools out there that make it, I'm not going to say it's easy, but make it a possibility. Some resources if you are interested in either one of these careers. NATA is the National Athletic Training Association. I talked about that a little bit. WADA is the Wisconsin Athletic Training, as well as VOC is the test site. Physical therapy, we have the APTA. And on the bottom I have PTCAS here, which is the application site. If you are interested in physical therapy, the PTCAS is a great site because it lists off all the programs as well as all of their requirements. For PT, every school has different requirements. Some schools require calculus, some don't, some require different chemistries. So it's kind of good to have an idea, you know, if there's a school you're thinking about, what do they require, so you make sure you take those classes to get into that program. Just to give you guys a snapshot, in my outpatient orthopedic setting, I see about 10 patients a day, 45 to 60 minutes at a time. I get to see a whole variety of things. I can treat everything from an ankle sprain to low back pain to a concussion patient all in the same day, shoulder surgery. There's just a wide variety, and that's what I like about my setting, is because I can never get bored. It's not like I'm just seeing knee patient after knee patient. There's different variety, and people are at different levels too. I may have someone who isn't walking. I may have someone who I'm running jumping tests with them so that they can get back to their sport. A big part of my day is the evaluation, re-evaluation of patients. First we evaluate to see where are their deficits, what do we need to do for them, and then we re-evaluate to see, are they improving? Do we need to change our plan, what we're doing? So I do a lot of that throughout the day. We assess how they're moving, you know, what different things do we need to do. That's where the skill of a physical therapist comes in, making sure they're doing things appropriately to help them get better. And then I develop plans of care for what we're going to do to get them better, as well as what they need to do to be an active participant. You can't just will someone better or work with them for 45 minutes and expect them to get better. They've got to do stuff on their own as well to help themselves. Some of the different equipment that we get to use, we've got different things, some fun stuff, kind of like you guys saw that virtual reality. I would be really interested if we could get that. But this guy right here is on a balance platform that measures weight, and they can do different testing. It works really great for post-surgical patients, as well as have used it on stroke patients. A lot of times when people have a stroke, it's on one side, so they don't know how much weight they're putting through their other leg. They're usually putting all their weight through one. So this is a good way to get them used to. The machine will actually let them know how much weight they're putting side to side. We use ultrasound, which is this machine, as well as Easton machines, which send an electrical current, mainly for pain, because sometimes patients, you can't do a whole lot when they first come because they're very painful. So sometimes we've got to get that pain calmed down before we can start. This is an Alter G treadmill, which is another really cool piece of equipment because it allows people to get back to running earlier. It actually takes weight off when people are moving. Running, you can set a certain body weight percentage. Last one down here is traction. A lot of times for my back injury patients, we hook them up to the machine, which looks a little bit barbaric. I promise it feels really good and they like it, because what it does is it allows there to be more space between the joints and it opens that up, especially if someone has a disc bulge in their back. Any questions on anything? Nobody gets squeamish? No? Okay. So this is a gymnast. Some of you guys may or may not have seen this.
If you get squeamish, please look away.
Yes.
Yeah, this is when she
Oh,
has
yeah.
both her knees.
Aerospace engineering major.
Such an impressive young lady.
Let's see how high she flies right here.
Yep.
I think she may be early.
So, what do you guys think happened?
It looks like all of her joints just snapped and yeah.
So,
That's a double dislocation.
definitely a knee dislocation, I would say. You guys think she broke anything? More than likely fractured at her tibia. She probably also, if she did not tear ligaments, more than likely has some pretty loose ligaments now where things are moving around. She may or may not need surgery. That's always a debate. With someone like this, depending on the extent of their injuries, this might be someone who goes 3 months without putting weight through their legs. So someone that we need to, they would come to me. We'd work on getting their motion in their knees. We'd also work on keeping the rest of their muscles strong. This is probably a year-long injury that she's going to take before she's even walking normal, let alone going back to sport. But it's key that in someone like this, we get them moving early and we start getting them back to their normal functioning. With the torn ligaments and everything, that she had the dislocation, more than likely I'm guessing she needed surgery, especially on one leg, if not both legs. So usually it's a good 6 months before we start really pushing this person to get them moving. Probably 9 months before she starts running or anything like that. Any questions?
So what do you do in that situation? How do you immobilize that individual?
So in this situation, come on, assess. First thing we're checking for is we're checking her feet, making sure she has pulse, making sure there's no blood flow restriction. What, in an ideal world, what we have is a splint that uses air, and you get around the leg and you pump it up, and it immobilizes it as is, as long as she has blood flow. Our biggest concern if they don't have blood flow is that can cause damage down into her foot, down into her ankle. So we want to make sure that blood is flowing. We'd immobilize probably both legs in splints like that, depending on if there is a fracture that we know of for sure. There are also traction splints that sometimes would be used in a situation like this that strap onto the leg and then it cranks up to provide space in there. That can be used if the blood flow is affected. And then from there you're going straight to the hospital to transport them. Make sure you wouldn't transport, call 911. Don't ever try and someone in a situation like this, you have the ambulance take them. You don't try and transport them yourself. If you're the athletic trainer, doctor on the side, anything, you're gonna want to make sure the ambulance takes them. They're gonna get them there into emergency room. More than likely she's getting imaging right away. They may or may not give her something for pain, depending on if they take her into surgery. In cases like this, they do not always do surgery right away. It might be a couple of days until swelling goes down so that they can see the extent of the injuries. I could almost say with at least 90% certainty she has a fracture somewhere in there. Whether or not it needs to be set would all depend on if the bone has moved, if it's a displaced fracture, whether or if it stayed in place. If it stays in place, sometimes they'll just put you in a brace, non-weight bearing, 3 months, go back and take imaging usually every month to make sure things are healing. If it's displaced, there's probably going to be screws as well as plates, sometimes halo contraption that actually sits outside of the leg that they put on them, depending on how they need to stabilize.
Gymnast in here? Dancers in here? You know you've had an injury, right? So this is not common, but.
No, not
it's-
fairly common, but
but-
you do see, and you see the same thing, you've, I'm sure, seen the basketball injuries where the Achilles rolls up, different things like that. And those are all athletes that stabilize, get them to the doctor, see what they need to do, but then you're the one working with them to get them back to functioning and making sure they can move again and go back to their sport. It's very important in these very competitive, whether it's college or pro teams, they've got a different timeline. Your average ACL is not gonna come back as fast as you'll see a pro football player come back. Typical ACLs are looking somewhere 9 months plus before they're getting back into sport-like activities. Now you might see a football player for a pro team come back in 3 months. That's not the typical process, but you also gotta think that guy's in therapy hours on end during a day, working very hard, because that's his full job. Any other questions on anything? If there are no questions, I'll show you guys a couple of things I brought today. So who thinks they're really strong? Anybody in here really strong?
No. You guys feel strong? She said, yeah, man. Come on down. He needs some of that, because he's, we want to see how strong he is,
I wanna
so
see
make
how
sure he can
strong
hold
he
on to
is.
the football.
So what this is diameter. We use it to test people's grip strength. So if someone has a shoulder injury or a hand injury, a lot of times what they'll do is they'll squeeze. So what we're gonna see, are you right or left-handed? Right-handed. So have you taken your right hand, you're gonna squeeze nice and tight for me. Good, and then relax. So you got 135, that's pounds of force. So have you try again. Nice. 139. Last one.
You can get it, 150. Let's go, baby.
You got 140. Now let's see, just for comparison, do you think that your other hand's gonna be just as strong?
Oh, no.
No, no worries. Let's see how different they are. Squeeze nice and tight, nice and tight. Not quite.
No.
So he only has 105 pounds of strength in his non-dominant hand.
Carry the ball in your right hand.
So if you try again, we'll do a couple more and see if that's.
Oh, that's right. So he dislocated that pinky a couple weeks ago. So that could definitely have.
So that'll,
There's a difference.
that will play a role. Typically, we do expect it, thank you very much. We do expect to see a difference. Now, if I have someone come in and they're gripping with their dominant hand and it's less than their non-dominant, I know there's something going on. A lot of times we find that to be neurological. Even if they're a shoulder injury, sometimes there's a nerve being pinched that's causing them to have that decreased grip strength when they're moving. So it's kind of a fun tool we get to use. Now sports have all gone to full swing. So anyone in here in sports? Sport right now? Okay. Anyone a runner? Cross country? How are your calves pretty tight? Your shins are tight? Okay. So if you're willing to come up here and be an example. So these are my Graston instruments, which is the training I went to. No, they're not knives, a lot of people think they are. But what we're gonna do, you said which motions? I may have, is it okay to just sit up on the table? I'm gonna have you up on the table. You'll just be sitting with your legs straight out. Both of them are pretty tight. So what we use these So, any allergies to lotions? Okay. So what I have here is cocoa butter. This allows these instruments to slide real nice and smooth. They've got different angles on them. Some of them are nice and rounded, sharp on one side. rounded on the other side, some of them are rounded on both sides. So what I'm gonna do here, pretty tight in here, a little tender. You let me know if this hurts at all, okay? So what I'm
Does it feel
using,
good, Liz?
we're buttering, as we call it. So I'm putting lotion on her leg. And then what we're gonna use is a different instrument, the rounded edge. And we're gonna come down here. That feel okay? Feel kind of weird? And what I'm doing is I'm assessing the tissue. Because of the metal in here, I can feel restrictions as I go over the muscle here. And as you might notice, it gets a little bit red in some spots. Does that feel painful at all? So she's getting a little bit of redness here as I go over, so I know that's a spot that's restricted. What that tells me then is I can take my other instrument and I can work more specifically in that spot to loosen up the restrictions. The nice part in this is a 10-minute treatment essentially, whereas if I was seeing her for something like this, I might be massaging for 20 minutes to get the same result. So it can cut your treatment time in half. This was a weekend course I went to. There's a couple different levels of the course to learn how to use the instruments. There's lots of opportunities when it comes to therapy to be able to pick and choose different things you're interested in and go to different courses. You do have to do continuing education for athletic training as well as physical therapy. So finding courses that you enjoy to go to for that education is always a good thing. How's it feel? Feels okay? Let's see how it's getting a little bit better. That feeling looser. Feels a little looser, probably even compared to this side. So, as you see, I don't think that even took a total of 5 minutes, but it's something nice. She'll be a little bit red, that'll fade away here within the next hour or so. Any questions on any of that?
I'll use myself as an example. It's not uncommon. I know every night it does, but like right now, this right hand is asleep. So is that something you guys are able to fix, or is that something I need to go to like a chiropractor, get my nerves assessed, by neurologist, or what?
So that is something, a lot of times to see physical therapists, you do have to go to the doctor a lot of times to get that referral. That's an insurance requirement. It is not, in the state of Wisconsin, you can just go to a therapist. However, your insurance won't deny it if you don't get the referral.
So that method, is that something that would possibly work?
It would, because a lot of times when you've got numbness and tingling in the hands, even same thing goes for the feet. For the hands, it's coming from the neck. Feet, a lot of times, it's coming from the low back. So that's something that we'll assess and see where things are going on. The hard thing for a lot of, even you guys probably, everyone's on their computers now. We're in this horrible forward posture. We're using our keyboards. And what happens when you're in this position is it affects how your muscles are sitting. It pinches on the nerves where you can get some numbness and tingling going down into the hands. Is it in your pinky or your whole hand?
All the way down. So I injured my neck in college. So it's.
So we know it's your neck.
Yeah. So literally at night, it's 2 or 3 hours of standing up, trying to get rid of I can't fall back asleep.
And that is something, a lot of times, there's a muscle imbalance in the neck. And so then we assess to see, we'd see how you're moving at the neck, and then as well as assessing the muscles along there, because that's typically what causes. Now, there is always the chance there's something going on at the elbow too, especially when it's coming from the forearm down. So that's where in your evaluation, you're assessing multiple joints to see where is this coming from. Because sometimes it's not as cut and dry where exactly the injury's coming from. A lot of times I have people come in and they tell me they got tingling feet. So they want me to look at their feet, but in reality it's coming from their back. So we have to assess the foot, but we're also making assessments, is there something going on at the knee, the hip, the back.
And you probably see that in really, really old patients, right? Like them, the tingling? Oh, okay.
I have seen it
Cause
I
he's
think
old.
my youngest was 18, all the way up to 90-year-olds. And unfortunately, like I said, with all of the technology that we use, which is great, but a lot of times I'm finding it more and more people who sit at a desk, work at a computer, they're always in this position. They tend to round the shoulders forward, the head drops forward. The laptops, unfortunately, are culprits of that as well.
Are you seeing stuff too with this generation, backpacks, heavy backpacks, is that starting to?
I wouldn't say backpacks as much as phones.
Oh.
I see a lot of headaches going on in this age because they're down here. Obviously, no one's gonna walk around putting your phone up here, I get that. But a lot of times from excessive use that way. And actually my coworker, I'm lucky enough, I treat everything except for here down. I have a coworker that does elbow, wrist, and hand. She's a certified hand specialist. So she does the thumbs, and she has seen some stuff with people's thumbs as well, from different things, just overuse.
Questions?
Is there anything on your sheets that you need information on? Do you have all the information you need for a good letter?
Graston, so it's Graston.
Graston for that Graston.
But I do have my card at you guys, if any of you are interested in physical therapy, have any questions that I want to ask here, you feel free to send me an email. We do also take students that want to serve, if you're interested in kind of seeing what we do during the day, we will take someone to come and observe. The other thing is, if you do decide to go into physical therapy, you typically do have to do some sort of observation in the clinic. So it's always a good thing to check out if you're interested in taking care of the people on them. Or if you have any questions, there should be an email or anything. More than likely 4 to 6 weeks to just how badly treated it is. What you can do. So if you want to protect it, don't do something too crazy.
For those people that came in late, those people that came up to conflict,
Okay.
Amanda Erdman,
So
Amanda Erdman, bone and joint physical therapy,
the muscle is typically
5200 Hummingbird Road, Suite 200. That's 01. So once again, Amanda Erdman, bone and joint physical therapy, 5200 Hummingbird Road, Suite 200, and that's 01, 54401.
How are we supposed to?
You're gonna write the thank you letter using the example that's on the front of that packet. You will print it off, and you'll bring it to Mr. Richard and myself on Thursday. Use that format, and everything should be on that left, just like that. That's the professional format that they teach in classes here.
So print out my Thursday?
For the Italian roll.
Yeah.